Understanding depression. Depression is a debilitating mental health condition characterized by a profound and persistent sense of sadness, hopelessness, and emotional distress. It affects an individual's thoughts, emotions, and behaviors, often leading to a range of physical and psychological symptoms that can significantly impair their daily functioning and overall quality of life. Causes of depression. Depression is a complex condition with multiple contributing factors, and its exact causes can vary from person to person. The development of depression is typically the result of a combination of biological, psychological, and environmental factors. Here are some of the key causes and contributors to depression. Biological factors. Genetics. Family history of depression can increase the risk of developing the condition. There may be genetic predispositions that make some individuals more susceptible. Neurochemical imbalance. Imbalances in neurotransmitters, such as serotonin, dopamine, and norepinephrine, in the brain can affect mood regulation and contribute to depression. Brain structure and function. Some structural and functional abnormalities in the brain have been associated with depression, though the exact mechanisms are still being studied. Psychological factors. Negative thought patterns. Persistent negative thinking, self-criticism, and rumination can contribute to the onset and maintenance of depression. Personality traits. Certain personality traits, like perfectionism or a tendency to worry excessively, may increase vulnerability to depression. Unresolved trauma. Past traumatic experiences, especially during childhood, can be a significant factor in the development of depression. Environmental factors. Chronic stress. Prolonged exposure to chronic stress, such as work-related stress, financial difficulties, or relationship problems, can be a trigger for depression. Life events. Major life events, particularly negative ones like the loss of a loved one, divorce, or job loss, can precipitate depressive episodes. Early adversity. Childhood adversity, neglect, or abuse can have long-term effects on mental health and increase the risk of depression in adulthood. Social isolation. Lack of social support, loneliness, and social isolation can contribute to the development and exacerbation of depression. Medical conditions. Some medical conditions, such as chronic illnesses, e.g., cancer, diabetes, hormonal imbalances, e.g., thyroid disorders, and chronic pain, can be associated with depression. Substance abuse. Substance abuse, including alcohol and drug addiction, is often linked to depression. Substance use can both lead to and result from depression. Medications. Certain medications, like some prescribed for hypertension or corticosteroids, can have depressive side effects in some individuals. Common symptoms of depression. Depression can manifest with a wide range of symptoms, and the severity and combination of symptoms can vary from person to person. Common symptoms of depression include persistent sadness or low mood, a pervasive feeling of sadness, emptiness, or hopelessness that lasts for most of the day, nearly every day. Loss of interest or pleasure. A marked decrease in interest or pleasure in activities that were once enjoyable, including hobbies, social interactions, and relationships. Fatigue and low energy. Feeling consistently tired or lacking the energy to engage in everyday activities. Sleep disturbances. Changes in sleep patterns, which may include insomnia, difficulty falling asleep or staying asleep, or hypersomnia, excessive sleep, including daytime napping. Changes in appetite or weight. Significant changes in appetite, leading to weight loss or gain. Some individuals may experience increased appetite and weight gain, while others may have reduced appetite and weight loss. Difficulty concentrating. Cognitive impairments, including difficulty focusing, making decisions, and retaining information. Feelings of worthlessness or guilt. A sense of excessive or inappropriate guilt, self-blame, or feelings of worthlessness. Irritability. An increase in irritability, anger, or frustration, even over minor issues. Physical symptoms. Unexplained aches and pains, headaches, digestive problems, and other physical discomforts. Social withdrawal. Isolating oneself from friends and family, often due to a lack of interest or the feeling that social interactions require too much effort. Thoughts of death or suicidal ideation. Recurrent thoughts of death, dying, or self-harm, including thoughts of suicide. Impact of depression. Unmanaged depression can have significant negative consequences on both an individual's mental and physical health, as well as their daily life. Here are some of the adverse effects of untreated or unmanaged depression. Mental health consequences. Worsening of depressive symptoms. Without treatment, depression often tends to worsen over time. Persistent sadness, hopelessness, and other symptoms can become more severe, making it increasingly difficult to function and find enjoyment in life. Suicidal ideation. Depression is a leading risk factor for suicide. Unmanaged depression can lead to increased thoughts of death and self-harm, and in severe cases, it may result in suicide attempts. Anxiety and other mental health issues. Depression frequently co-occurs with anxiety disorders and other mental health conditions, leading to heightened emotional distress and impairment. Cognitive impairments. Untreated depression can lead to cognitive impairments, including difficulties with concentration, memory, and decision-making. Physical health consequences. Increased risk of chronic illness. Unmanaged depression has been associated with a higher risk of developing or worsening chronic health conditions, such as cardiovascular disease, diabetes, and autoimmune disorders. Sleep disorders. Persistent sleep disturbances, including insomnia and hypersomnia, can exacerbate physical health issues and impair overall well-being. Weakened immune system. Depression can weaken the immune system, making individuals more susceptible to infections and illnesses. Chronic pain. Physical symptoms of depression, such as unexplained aches and pains, can lead to chronic pain conditions. Impact on daily life. Impaired work and academic functioning. Individuals with untreated depression often struggle to meet their responsibilities at work or school. This can lead to decreased productivity, increased absenteeism, and potential job or academic loss. Social isolation. Depression can lead to social withdrawal, affecting relationships with friends and family, and leading to feelings of loneliness and isolation. Substance abuse. Some individuals with depression turn to alcohol or drugs as a way to self-medicate or cope with their symptoms, which can result in substance abuse and addiction. Financial and legal issues. Unmanaged depression can lead to financial problems due to work-related issues and legal complications, especially if the individual's symptoms lead to poor decision-making. Impaired quality of life. The overall quality of life is significantly reduced for individuals with untreated depression, as they may find it challenging to engage in activities they once enjoyed, maintain relationships, and experience life satisfaction. Increased mortality risk. Depression has been linked to an increased risk of premature death, often due to its effects on physical health and the greater likelihood of risky behaviors, including self-harm. Recognizing depression. Recognizing depression in yourself or someone else can be challenging, as the symptoms may vary in severity and presentation. However, there are common signs and indicators that can help you recognize depression. If you or someone you know is experiencing several of these symptoms persistently for more than 2 weeks, it's essential to seek help from a mental health professional. Here are some ways to recognize depression. Persistent low mood. Depression is characterized by a pervasive feeling of sadness, hopelessness, or emptiness that persists most of the day, nearly every day. Loss of interest or pleasure. A marked decrease in interest or pleasure in activities that were once enjoyable, such as hobbies, socializing, or work. Changes in appetite and weight. Significant changes in eating habits that result in noticeable weight loss or gain. This can include increased or decreased appetite. Sleep disturbances. Changes in sleep patterns, which may include insomnia, difficulty sleeping, or hypersomnia, excessive sleep, including daytime napping. Fatigue and low energy, feeling persistently tired, lethargic, or lacking the energy to engage in everyday activities. Feelings of worthlessness or guilt. A sense of excessive or inappropriate guilt, self-blame, or feelings of worthlessness. Difficulty concentrating. Cognitive impairments, including difficulty focusing, making decisions, and retaining information. Irritability. Increased irritability, frustration, or a short temper, often over minor issues. Physical symptoms. Unexplained aches, pains, headaches, digestive problems, and other physical discomforts. Social withdrawal. Isolating oneself from friends and family, often due to a lack of interest or the feeling that social interactions require too much effort. Thoughts of death or suicidal ideation. Recurrent thoughts of death, dying, or self-harm, including thoughts of suicide. Changes in self-care. Neglect of personal hygiene and self-care, such as bathing, grooming, and cleaning. Slowed movement or speech. Observable physical changes, such as slowed movements or speech, which may be an outward manifestation of the internal emotional distress. Remember, it's important to note that not everyone with depression will experience all of these symptoms, and some individuals may have symptoms not listed here. Additionally, the severity and duration of symptoms can vary. Self-help strategies. Self-help strategies can be effective in managing and overcoming depression, especially when used in conjunction with professional treatment. While self-help strategies may not replace the need for therapy or medication in some cases, they can be valuable tools for improving your mental health. Here are some self-help strategies to consider. Education. Understanding depression and its symptoms is the first step. Learn about the condition, its causes, and available treatments. Knowledge empowers you to make informed decisions. Self-awareness. Pay attention to your thoughts and emotions. Journaling can help you identify patterns and triggers of your depressive episodes. Set realistic goals. Establish small, achievable goals. Accomplishing them can boost your self-esteem and motivation. Routine and structure. Establish a daily routine that includes regular sleep, exercise, and meal times. A structured day can provide a sense of stability. Healthy lifestyle. Incorporate regular exercise into your routine. Physical activity can release endorphins and improve your mood. Eat a balanced diet, stay hydrated, and avoid excessive caffeine and alcohol. Sleep hygiene. Prioritize good sleep habits, such as maintaining a consistent sleep schedule and creating a comfortable sleep environment. Mindfulness and relaxation techniques. Practice mindfulness meditation, deep breathing exercises, and progressive muscle relaxation to reduce stress and improve emotional well-being. Social support. Connect with friends and family members, even when it feels challenging. Isolation can worsen depression, so maintaining social connections is important. Hobbies and interests. Re-engage in activities you used to enjoy or explore new hobbies and interests. Rediscovering passions can bring a sense of fulfillment. Limit stress. Identify and minimize sources of stress in your life. This may involve setting boundaries, saying no when necessary, and delegating tasks. Positive affirmations. Challenge negative self-talk with positive affirmations. Replace self-criticism with self-compassion. Cognitive behavioral techniques. Learn and practice cognitive behavioral therapy, CBT, techniques to address negative thought patterns and replace them with more constructive thinking. Journaling. Keep a journal to record your thoughts and feelings, track your mood, and identify patterns that can inform your self-help strategies. Seek support groups. Join a depression support group, either in person or online, to connect with others who are experiencing similar challenges. Volunteer or help others. Helping others can provide a sense of purpose and satisfaction. It also fosters social connections. Set boundaries. Learn to say no and set healthy boundaries in your personal and professional life. Overcommitting can contribute to stress and exacerbate depression. Art and creativity. Engage in creative outlets like art, music, writing, or other forms of self-expression. Professional help. If self-help strategies aren't sufficient or your symptoms are severe, consult a mental health professional, such as a therapist or psychiatrist. They can provide therapy and medication when necessary. Remember that recovery from depression is a journey, and progress may be gradual. It's essential to be patient with yourself and to seek professional help when needed. Combining self-help strategies with professional treatment can provide a comprehensive approach to managing and overcoming depression. Social support and its significance in overcoming depression. Social support plays a crucial role in overcoming depression and promoting mental well-being. Here are some ways in which social support is significant in dealing with depression. Emotional support. Friends, family, and loved ones can offer emotional support by providing empathy, understanding, and a non-judgmental space for individuals experiencing depression. Knowing that there are people who care about their well-being can help individuals feel less isolated. Practical support. Practical assistance, such as help with daily tasks, chores, or responsibilities, can alleviate the burden on someone dealing with depression. This type of support can make it easier for individuals to focus on their mental health without the added stress of managing various tasks. Informational support. Friends and family can provide valuable information about depression, treatment options, and available resources. This can empower individuals to make informed decisions about their mental health and seek appropriate professional help. Validation. Social support can provide validation for the feelings and experiences of those with depression. Feeling understood and acknowledged is important in reducing the stigma associated with mental health issues and fostering a sense of acceptance. Reducing isolation. Depression often leads to social withdrawal and isolation. Social support helps counteract this by encouraging social interactions and engagement. Having a support network can motivate individuals to participate in activities, fostering a sense of connection and belonging. Encouragement for treatment. Friends and family can encourage individuals to seek professional help, such as therapy or counseling. Motivation and encouragement from loved ones can be a powerful factor in someone's decision to initiate and continue treatment. Sense of belonging. Being part of a supportive community or having a close-knit social circle can provide individuals with a sense of belonging. This sense of connection can contribute to overall well-being and act as a protective factor against depression. Crisis intervention. In times of crisis, having a social support system can be crucial. Friends and family can help in identifying warning signs, providing immediate assistance, and facilitating access to emergency mental health services. Medication on depression. Medication is one of the treatment options for depression, and it can be effective in managing symptoms, especially in moderate to severe cases. There are several classes of medications used to treat depression, and the choice of medication depends on various factors, including the type and severity of depression, potential side effects, and an individual's medical history. Here are some commonly prescribed classes of medications for depression. Selective serotonin reuptake inhibitors, SSRIs. SSRIs are one of the most widely used classes of antidepressants. They work by increasing the levels of serotonin, a neurotransmitter associated with mood, in the brain. Common SSRIs include fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs also affect serotonin levels and additionally target norepinephrine. Examples include venlafaxine, Effexor, and duloxetine, Cymbalta. Tricyclic antidepressants, TCAs. TCAs were among the first antidepressants developed. They work on multiple neurotransmitters, including serotonin and norepinephrine. Due to their potential for side effects, TCAs are typically used when other treatments are ineffective. Monoamine oxidase inhibitors (MAOIs). MAOIs are another class of older antidepressants. They affect several neurotransmitters and are used less frequently today due to dietary restrictions and potential drug interactions. Atypical antidepressants. These are a diverse group of medications that don't fit into the above categories. Bupropion, Wellbutrin, mirtazapine, Remeron, and trazodone, Deserel, are examples of atypical antidepressants. Ketamine. Ketamine, originally an anesthetic, has gained attention as a rapid-acting antidepressant, particularly for treatment-resistant depression. It is often administered intravenously in a clinical setting. It's important to note that medication should be prescribed by a qualified healthcare professional, typically a psychiatrist, who can carefully assess your condition, consider your medical history, and monitor your response to the medication. Key points to keep in mind regarding medication for depression. Effectiveness. Medication can be highly effective in reducing depressive symptoms. However, it may take several weeks to feel the full benefit. Side effects. Antidepressants can have side effects, including nausea, weight changes, sexual dysfunction, and others. These side effects vary depending on the medication. Individual variation. Not all antidepressants work the same way for everyone. It may take time to find the right medication and dosage that works best for you. Combination with therapy. Medication is often used in combination with psychotherapy, such as cognitive behavioral therapy, CBT, for a more comprehensive approach to treatment. Regular follow-up. While taking medication, it's essential to have regular check-ins with your healthcare provider to monitor your progress, adjust dosages, and address any concerns. Avoid abrupt discontinuation. Crucial not to stop taking medication abruptly. Tapering off under a doctor's guidance is recommended to avoid withdrawal and relapse. Medication is just one aspect of treating depression. Lifestyle changes, therapy, and social support are also essential components of a comprehensive treatment plan. The choice to use medication should be made in consultation with a healthcare professional who can assess your individual needs and provide appropriate guidance. Coping mechanisms. Coping mechanisms for overcoming depression are strategies and techniques that individuals can use to manage their symptoms, improve their mental health, and work towards recovery. It's important to note that coping mechanisms can vary from person to person, and what works for one individual may not work for another. Here are some coping mechanisms that can be helpful in dealing with depression. Seek professional help. Consulting a mental health professional, such as a therapist, counselor, or psychiatrist, is crucial. They can provide evidence-based treatments, such as psychotherapy and medication, tailored to your specific needs. Cognitive behavioral therapy, CBT, CBT is a form of psychotherapy that helps individuals identify and challenge negative thought patterns and replace them with more constructive thinking. Learning to reframe negative thoughts can be an effective tool for managing depression. Mindfulness and meditation. Practicing mindfulness and meditation techniques can help individuals stay grounded in the present moment and reduce anxiety and depressive symptoms. Regular exercise. Engaging in regular physical activity has been shown to improve mood and reduce symptoms of depression. Exercise releases endorphins, which are natural mood boosters. Healthy diet. A balanced diet with adequate nutrients can positively impact mental health. Foods rich in omega-3 fatty acids, such as fish, and a variety of fruits and vegetables are associated with improved mood. Sleep hygiene. Prioritize good sleep habits, including maintaining a consistent sleep schedule and creating a comfortable sleep environment. Stress reduction techniques. Employ stress management techniques, such as deep breathing exercises, progressive muscle relaxation, or yoga, to lower stress levels. Social support. Maintain connections with friends and family who can provide emotional support. Open and honest communication can reduce feelings of isolation. Journaling. Keeping a journal to record thoughts and emotions can help individuals track their mood and identify triggers and patterns. Positive affirmations. Challenge negative self-talk with positive affirmations and practice self-compassion. Hobbies and interests. Engage in activities that bring joy and a sense of purpose. Rediscovering old interests or exploring new ones can improve mood. Set realistic goals. Establish small, achievable goals to build a sense of accomplishment and motivation. Relaxation techniques. Use relaxation methods, such as listening to calming music, taking warm baths, or spending time in nature, to reduce stress and promote relaxation. Limit alcohol and substance use. Excessive alcohol and drug use can worsen depression. Reducing or eliminating their consumption can be a significant coping strategy. Join support groups. Participate in depression support groups where you can connect with others who share similar experiences, offer mutual support, and learn from each other. Self-care. Prioritize self-care by setting aside time for activities that promote well-being, such as self-compassion, self-reflection, and self-soothing practices. Professional assistance. If symptoms worsen or suicidal thoughts arise, seek immediate help from a mental health professional or crisis hotline. Coping with depression is a gradual process, and it may involve a combination of these strategies. It's essential to be patient with yourself, and if one approach doesn't work, don't be discouraged, try another. Additionally, ongoing support from mental health professionals, friends, and family can be instrumental in your journey to overcome depression. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a widely used and evidence-based approach to treating depression. CBT focuses on helping individuals identify and challenge negative thought patterns and behaviors that contribute to their depressive symptoms. Here's how CBT is used in the treatment of depression. Identification of negative thought patterns. In the early stages of CBT for depression, individuals work with a trained therapist to identify their negative thought patterns, which often involve self-criticism, hopelessness, and catastrophic thinking. Cognitive restructuring. Once negative thought patterns are identified, CBT helps individuals reframe and challenge these thoughts. They learn to replace them with more balanced and rational thoughts. For example, if a person has the negative thought, "I'm a failure," CBT can help them reframe it as, "I've faced setbacks, but I can learn from them and improve." Behavioral activation. Depression often leads to social withdrawal and a reduction in pleasurable activities. CBT encourages individuals to re-engage in these activities, even when they don't initially feel like doing so. This can help improve mood and motivation. Homework assignments. Therapists often assign homework between sessions to practice the skills learned in therapy. Homework might include keeping a thought journal, monitoring mood, or challenging negative thoughts as they arise. Skill building. CBT equips individuals with coping strategies to manage and reduce depressive symptoms. These skills can include stress reduction techniques, communication skills, and assertiveness training. Relapse prevention. CBT emphasizes long-term well-being and equips individuals with tools to prevent future depressive episodes. It teaches them to recognize early signs of depression and how to respond effectively. Support and collaboration. The therapeutic relationship is built on collaboration and support. Therapists work with individuals to set goals, track progress, and address any challenges that may arise during treatment. Duration of treatment. CBT for depression is often a time-limited treatment, typically consisting of 12 to 20 sessions. However, the number of sessions may vary based on the individual's needs and progress. CBT is considered an effective treatment for depression because it focuses on changing thought patterns and behaviors, which are central to the maintenance of depressive symptoms. It can be used alone or in combination with medication, depending on the severity of the depression and the individual's preferences. It's essential to seek a qualified mental health professional, such as a therapist or psychologist, trained in CBT for the treatment of depression. CBT can be adapted to fit an individual's unique needs, making it a highly versatile and personalized approach to addressing depressive symptoms. Self-care. Self-care is a vital component of managing and overcoming depression. It involves taking deliberate actions to promote physical, emotional, and mental well-being. Here are some tips for self-care that can help individuals in their journey to overcome depression. Seek professional help. First and foremost, reach out to a mental health professional, such as a therapist or psychiatrist, for an accurate diagnosis and treatment plan tailored to your needs. Medication management. If prescribed, take your medication as directed by your healthcare provider. Communicate openly about any side effects or concerns. Self-compassion. Be kind and patient with yourself. Recognize that depression is an illness, not a personal failing. Avoid self-criticism and practice self-compassion. Establish a routine. Create a daily schedule that includes regular sleep, exercise, meal times, and self-care activities. A structured routine can provide stability and a sense of purpose. Physical activity. Engage in regular physical exercise. Even short walks can have a positive impact on mood. Exercise releases endorphins, which are natural mood lifters. Balanced diet. Maintain a healthy diet that includes a variety of fruits, vegetables, lean proteins, and whole grains. Avoid excessive caffeine and alcohol, which can exacerbate depression. Adequate sleep. Prioritize good sleep hygiene. Maintain a consistent sleep schedule, create a comfortable sleep environment, and avoid stimulating activities before bedtime. Mindfulness and relaxation. Practice mindfulness meditation, deep breathing exercises, and progressive muscle relaxation to reduce stress and promote emotional well-being. Hobbies and interests. Engage in activities that bring you joy and a sense of purpose. Reconnecting with old interests or exploring new ones can boost your mood. Social connections. Maintain contact with supportive friends and family. Share your feelings and concerns with trusted individuals and seek social support when needed. Positive affirmations. Challenge negative self-talk with positive affirmations and replace self-criticism with self-affirmation. Journaling. Keep a journal to record your thoughts and feelings. This can help you identify patterns, triggers, and emotions associated with your depression. Setting realistic goals. Establish small, achievable goals to build a sense of accomplishment and motivation. Limit stress. Identify and reduce sources of stress in your life. This may involve setting boundaries, saying no when necessary, and delegating tasks. Self-care activities. Set aside time for self-care activities that bring you comfort and relaxation, such as taking warm baths, reading, or practicing a hobby. Support networks. Join a depression support group, either in person or online, to connect with others who understand your experiences and challenges. Regular check-ins. Have regular check-ins with your healthcare provider to monitor your progress, adjust treatment as needed, and address any concerns. Crisis plan. Develop a crisis plan in case of severe symptoms or suicidal thoughts. Know where to seek immediate help, such as a crisis hotline or emergency services. Remember that self-care is not a one-size-fits-all approach. It's important to tailor your self-care strategies to your individual needs and preferences. Overcoming depression can be a gradual process, and seeking help from mental health professionals is an essential part of your journey toward recovery. Thank you so much for joining me today to discuss such an important and often stigmatized topic, depression. We've covered a lot of ground, from understanding the signs and symptoms to coping strategies and seeking professional help. Depression is a challenging journey, but remember that you are not alone. There is help, there is hope, and there are countless people who care about your well-being. It's crucial to break the silence and stigma surrounding mental health issues. You are brave for seeking knowledge and understanding. If you found this video informative and helpful, please consider giving it a thumbs up and subscribing to our channel. Your support allows us to continue creating content that raises awareness and provides valuable insights on mental health. If you have any questions or want to share your experiences or thoughts, please leave a comment below. We're here to support and learn from one another. Together, we can make a positive difference in the lives of those dealing with depression. Remember, reaching out for help is a sign of strength, not weakness. If you or someone you know is struggling with depression, don't hesitate to seek professional assistance. You deserve to live a fulfilling, joyful life. Thank you again for being a part of this community, and I look forward to continuing this journey with you. Stay strong, stay connected, and take care of your mental health. You are not alone, and there is hope on the horizon. Thank you so much for joining me today to discuss such an important and often stigmatized topic, depression. We've covered a lot of ground, from understanding the signs and symptoms to coping strategies and seeking professional help. Depression is a challenging journey, but remember that you are not alone. There is help, there is hope, and there are countless people who care about your well-being. It's crucial to break the silence and stigma surrounding mental health issues. You are brave for seeking knowledge and understanding. If you found this video informative and helpful, please consider giving it a thumbs up and subscribing to our channel. Your support allows us to continue creating content that raises awareness and provides valuable insights on mental health. If you have any questions or want to share your experiences or thoughts, please leave a comment below. We're here to support and learn from one another. Together, we can make a positive difference in the lives of those dealing with depression. Remember, reaching out for help is a sign of strength, not weakness. If you or someone you know is struggling with depression, don't hesitate to seek professional assistance. You deserve to live a fulfilling, joyful life. Thank you again for being a part of this community, and I look forward to continuing this journey with you. Stay strong, stay connected, and take care of your mental health. You are not alone, and there is hope on the horizon.